Assalamu alaikum and Bismillahir Rahmanir Rahim. Dear student, and we are here with the topic number 2 of ABC of CBC. In the first lecture, we discuss about the whole parameters of CBC. In that lecture, we discussed that what is the importance of WBC, how many types of WBC we can see in CBC report, and then what is the importance of DLC and absolute counts. Then further we have some very important discussion on RBC, and in RBC we discuss hemoglobin and red blood cell indices like MCV, MCH, MCHC, and RDW, red cell distribution width, and then we finally discuss the platelet rate, mean platelet volume. Now in today discussion, we will mostly focus on the hemograms, and basically these are the reports. How we will follow, how we will get a normal result or abnormal result. How can we differentiate between microcytic and macrocytic? So understanding these all issues, we have some reports here, and one by one we will discuss it. So this is the first report, or you call it a hemogram. It's a CBC report, and the first thing you will observe is hemoglobin. Here you can see that hemoglobin is 16.2. Then you will move forward and check the WBCs. So WBCs are 6.8 per microliter. So the normal count for WBC is 4,000 to 11,000 per microliter. Here you can see that this is normal. Then you will go to hemoglobin, and the hemoglobin are 16.2 as I told you before, and the normal value of hemoglobin is 12 to 14 in female, and 14 to 16 and 14 to 17 in male. HCT is normal, MCV, MCH and MCHC are normal, and the platelet are 1,50,000 to 4,50,000 is normal. 179 is a normal report. So the first thing, whenever you are looking toward a CBC report, you will observe three things: WBC, hemoglobin, and platelet. Because these three lines are very important, and if you have some problem in WBC, then you think about the infections, viral infection or bacterial infection or something else, or some abnormal cells as well. And for hemoglobin, if hemoglobin is lower than its normal limit, then you will think about the MCV and MCH and MCHC, that whether the report is microcytic or macrocytic, or there are some abnormality. Then you look forward to RDW, and after RDW is normal, it's mean there is a uniform population. But there is some problem with RDW along with MCV. Then you think about the anisocytosis or something. Something is very important to check the peripheral blood smear. And finally, the platelet. So here we have normal platelet, but if it is low or very high, then you check your peripheral report, and you will see what abnormality are seen in the peripheral smear. Now, how approach toward anemia? First, you will observe, or you will look toward the hemoglobin, and if hemoglobin is lower than its normal limit, then you will check MCV, and MCV is the most important indices or most important parameter of a CBC report, by which we can observe, or by which we can diagnose that whether the cell is normal, abnormal. Normal, it's mean that is normocytic cell, but if there is low hemoglobin, then you call it normocytic anemia. And if MCV is higher than its normal limit, then you'll call it macrocytic anemia. And the normal, lower than the normal size, is called microcytic. And here are some disease that like in microcytic hyperchromic anemia, we have the most important iron deficiency anemia, some chronic infections, thalassemia, hemoglobinopathies, and sideroblastic anemia is the most important example of microcytic hyperchromic anemia, where in normocytic macrocytic anemia, we have chronic disease, early IDA, like there are some phases of iron deficiency anemia. We will discuss it in the iron deficiency anemia with detail. There are three different phases. So in early IDA, we have normocytic anemia, and then same here in hemoglobinopathies, primary mirror disorder, combined deficiencies, or increased destruction. So we get some normocytic anemias over here. And if MCV is higher than its normal, like normal range for MCV is 80 to 100, and if this range is above 100, then we call it macrocytic anemia, along with peripheral smear, because in peripheral smear we will get some macrocytes over there. And the most important exam are megaloblastic anemias, and liver disease and alcohol disease, hemoglobinopathies, metabolic disorders, marrow disorder, and increased destruction. So here we get some macrocytic anemia, but the most important are megaloblastic anemia, folate deficiency, or vitamin B12 deficiency. Similarly, in liver disease, alcoholism, or some chemotherapies, we also get some macrocytic anemias. Then uh, here you will see that RBC volume rather is measured by the mean cell volume and RDW. So MCV, if it is lower than 80 femtoliter, so then we call it microcytic anemia. But remember that you will also focus a slide, because if you have some abnormality, then an abnormality in the CBC report, you must go for a slide and stand a peripheral smear and focus it on a microscope, look for microcytes over there. Like in some disease, or like iron deficiency anemia, we have some elliptical cells as well, but they are hypochromic. Similarly, MCV, if its value is about 80 to 100 femtoliter, that is a normal value of MCV. So we have normocytic, and if it is more than 100 femtoliter, then we have macrocytic anemias. RDW, a very important tool along with MCV and hemoglobin. And if we have uniform population, then it's normal. But if we have some double population, there is an isocytosis variation in size, then RDW come very high, and we must go for a slide over here. We cannot neglect it. So RDW is very important, and we have discussed it in our first lecture as well. So here we have another report, and this is a normal report. The first thing you will look or you observe is the patient age and his sex, male, female, or his age. Like adult have different normal values, and infants or child have different normal values. So this is the most important thing. You will never miss this. And then in a CBC report, you will look for three things, three parameters. There are WBCs, RBCs or hemoglobin, and finally platelets. You will never miss these three parameters in a CBC report, because if you're looking toward WBCs and here is some abnormality in WBC, and you will look to hemoglobin, there is also some abnormality, but if you missed it, so it's not a good approach. So discussing this report, first we'll look toward WBCs, and here we know that the normal value for WBC is 4,000 to 11,000 per microliter, and here we have 5.5. It's mean that it's normal report. Then you look forward to neutrophil 54.7, lymphocyte 34, monocyte, eosinophil, and basophil. It's mean that this is a normal for WBCs. Now you will go forward toward hemoglobin. So here you are get some abnormality, and here you see that the normal value for hemoglobin according to age and sex or something, like we have 12 to 16, a normal range value. It's a general value. So here we have 9.7. It's mean that hemoglobin is low, and this man or female is suffering from anemia. Okay, now you will think about that either this anemia is microcytic, macrocytic, or normocytic. Then you will go forward and look for MCV. So here MCV is 69.7. It's mean that it's lower than the normal, and we have a range 80 to 100 femtoliters. So it's mean that we have lower level of MCV So this is microcytic anemia, and then you go forward and see the MCH. So MCH is 22.6, and we have 27 to 32 normal value picogram for MCH, and here we also have deficiency. So MCH is also low. So it's mean that this is microcytic hypochromic anemia. And here we have RBC count 4.28. It's mean that it's also lower than its normal limit. So WBC is the normal, and whenever we see toward the hemoglobin parameters, so it's mean that this is a microcytic hypochromic anemia. Then finally you will look toward the platelets, and the platelets are in normal range because we have 1,50,000 to 4,50,000 the normal count for a platelet. So here we have no abnormality in WBCs and in platelet, but we have some abnormality in hemoglobin parameters, and this is microcytic hypochromic anemia. Now you think about that, what are the cases in which we have microcytic hypochromic anemia. So the most important, the first thing, that is microcytic hypochromic, so iron deficiency anemia. So first you will think about the iron deficiency anemia. For this you will see RDW. So RDW is very high. It is 18.4, and it's mean that this parameter or this CBC report need a slide. So you will make a peripheral slide, and then you will focus it and look for rarely they are microcytic. You will look forward, and if there are some abnormality in the peripheral smear, so you must see microcytic cells. These microcytic cells will be hypochromic as well, so you will get microcytic hypochromic cell. And in iron deficiency anemia we have some elliptical cell, pencil cell. So if there are some pencil cells or elliptical cells and along with microcytic hypochromic anemia, so then this is a case of suspected case of IDA, but still you will not recommend or you will not report it IDA. You will get your recommendation that go for some iron profile, and you will confirm it by iron profile. So this report is for IDA, iron deficiency anemia, and basically it's a microcytic hypochromic anemia. Now when we make it slide, so on the slide we have such type of cells. These are the red blood cells which are severely hypochromic, and they are smaller than its normal size, so they are microcytic. And on a peripheral smear, you must remember that with a mature lymphocyte, the nucleus of a mature lymphocyte, we'll compare it. If we do not have any clue or something else, so we will. It is a very good indicator for checking the normocytic or microcytic or macrocytic cells. So here this is lower than its normal limit, and already we checked the CBC report. So there we have low MCV. So this is a report. This is a peripheral slide, and here we have microcytic hypochromic cell, microcytic hypochromic, and you see RDW is high, and you will check for pencil cells, some pencil cells, because IDA also have pencil cells. So here this is an elliptical cells. Okay, we can't see other elliptical cells over here. So this report is for microcytic hypochromic anemia, and most probably it is IDA, mean iron deficiency anemia. The same case is in thalassemia minor, but in thalassemia minor you'll remember that normally we have lower RBC count in IDA or some cerebrovascular anemia or anemia of chronic disorder, but in thalassemia minor we have high RBC count. So remember one thing, that there is microcytic hypochromia, MCV is low, but RBC is higher than its normal range. This is another case, and it's a case for macrocytic anemia. So here again we have three things. First you will look toward WBCs. So here it's 12.1. It's mean that it's higher than normal. Here we have some infection. Now we'll think about whether this is infection is neutrophilic or lymphocytic. So the neutrophil are higher. Here we have 71.1. It means that it's slightly high, and lymphocyte is 15.9, because you can see here that normal range for WBC is 4,000 to 11,000 per microliter, but here you see that it's 12.1, not more high. So here neutrophil is higher than its normal limit, and lymphocytes are normal, okay, slightly lower, but because one parameter, if neutrophil has become high, so lymphocytes are coming down. Eosinophil, monocyte, and basophil. Here we have high basophil as well. So basophil are also normal, also high over here. So in WBCs, we have high WBC count along with slightly high neutrophil count and high basophil count over here. Now you will go for the second option, and here we have hemoglobin. So hemoglobin is 10.6. It's mean that it's lower than its normal limit. So it's we find it here anemia. Now we will think about that whether this anemia is microcytic, macrocytic, or normocytic. Then we will move forward for MCV and for MCV. So you look here that MCV is 117. It's mean it's higher than its normal limit. The normal limit for MCV is 80 to 100 femtoliter, and it's 117. It's mean that it's very high. So it's macrocytic anemia. Now here we have MCH and MCHC. Because the cell is high, that's why here we have hyperchromia, but we cannot mention it because it's not a good term. And we have macrocytic anemia over here. Okay, RDW is normal 14.1, because all have the uniform population, all the population is macrocytic, and platelet count is also high. So in megaloblastic anemia we get some high platelet count, that is 578. So the normal range 1,50,000 to 4,50,000, and here you can see that the value for platelet is high. So this is a case we get here that we have macrocytic anemia along with infection and high platelet count. So we'll report as like macrocytic anemia or macrocytic red blood cells with hypochromia, and WBCs WBCs show high count, especially for basophil. And platelet count is also high, so we can we can write that here we have thrombocytosis. Now this is a slide for macrocytic anemia, and remember one thing, that in macrocytic anemia we have hypersegmented neutrophil because we have folate or vitamin B12 deficiency. That's why the nucleus is showing abnormality, and normally we have 3 to 5 lobes, but in macrocytic anemia the lobes are high, more than 7 lobes. So if we have some sort of this like peripheral smear, so we think about the macrocytic anemia, megaloblastic anemia, folate deficiency, and vitamin B12 deficiency. Then we will check for folate profile or for vitamin B12, serum vitamin B12. So this is a report for macrocytosis, and here you can see that the cells are larger than its normal limit. We have some normal population over here like this one or this one, but remember that we have a high RBC's size, mean that MCV is higher than its normal limit. So this is a case of macrocytic anemia. So up to here we discussed two different cases. The first one is microcytic anemia. In microcytic anemia, the first thing we look toward is its MCV hemoglobin, and if MCV is lower, then we look toward its peripheral smear. And peripheral smear we have microcytosis along with hypochromia, and if this is a case of IDA, iron deficiency anemia, then we have some elliptical cells as well. And in macrocytic anemia we have high MCV along with hypersegmented neutrophils. So when you think about the folate or vitamin B12 deficiency, but you will not write or report in which you confirm it that it is megaloblastic anemia or it is folate deficiency anemia, because you will go for further test. For iron deficiency anemia you will go for iron profile, and for macrocytic anemias you must go for folate or vitamin B12 profile. Uh, In thalassemia minor, one thing that I told you that we have microcytic hypochromic anemia. There is variability in the peripheral smear, that when you look toward the peripheral smear, you will see aniso and peculocytosis. You will see target cells, you will see teardrop cell, you will see dacrocytes, elliptical cells, and sometimes we also have thalassemia minor along with iron deficiency anemia. So there have still severe deficiencies of microcytic hypochromia, and there are certain different cases like sideroblastic anemia or anemia of chronic disorder. So in that cases we will discuss it in more detail. So this is a hyper-segmented neutrophil, and as I told you that the presence of hyper-segmented neutrophil is an important diagnostic feature of megaloblastic anemia. Neutrophil hypersegmentation can be defined as the presence of neutrophil with 6 or more lobes, or the presence of more than 3% of neutrophil. This is very important, that the presence of more than 3% of neutrophil with at least 5 loops. So we can't that here we have hypersegmentation. Now remember one thing, that whenever you are looking toward a peripheral report or CBC report, so we must look toward its age and sex. And for adult male and female we have different values, but for infants we have mostly different values. So this is a very important chart, and it must be in your labs. It's because for 0 to 1 month the normal range for RBC is 3.90 to 5.90, and if you see its hematocrit at 42 to 65, and if you see its hemoglobin, say it's 13.4 to 19.9. So if you have report like this and you see that here we have 19.5 hemoglobin, so you will think about that, oh, here we have polycythemia. But if you check his age and age 6, then you will think, oh, it's a normal report. So this is very important. You must remember, you must memorize this, and you must have the copy of this report in your lab. So here we have different values, like 0 to 1 month, 1 to 2 months, then 2 to 3 months, then 3 to 6 months, and 6 months to up to 1 year. We have different normal values for red blood cell, hematocrit, hemoglobin, MCH, MCV, and MCHC. And white blood cells also have different values in different years, like up to 1 month, 9,000 to 3,000, 900,000 to 30,000, it's a normal count. And then for 1 to 3 months we have 5,000, and it's become more lower, it's become 19,000 to 500, 90,500. And from 3 months to 1 year, count is 6,000 to 17,500. And you see that whenever it's become 2 to 4 year, the count become 5,500 to 15,500. Still it's higher than the adult life. And one thing, one thing to remember, that in adult life we have the normal neutrophil count, like 40 to 60, or sometime we have 50 to 70. But here you have different values, because here you have lymphocytosis in the WBC's count. So this is very important tool. And while checking the report, the first thing is to check his age and sex. It's very important, because it's the base of your report. If you know about this, then you will go for a good diagnostic approach. And if you miss this, so then you have a wrong report, and you will get a wrong medication for the patient as well. So it's all about the CBC reports. And summarizing this, the first thing is looking toward its age and sex, then looking toward WBC's count. Along with WBC's count, you will check its neutrophil count, lymphocyte count, mean DLC. Then you will go forward for the RBCs indices, and you will check for hemoglobin. If hemoglobin is lower, then you will see that whether we have high MCV or low MCV. On the basis of MCV, we can say that it's microcytic or macrocytic. Then we have different examples for microcytic, like iron deficiency anemia, thalassemia minor, sideroblastic anemia, anemia of chronic disorder. For macrocytic anemia, we have vitamin B12, we have pernicious anemia, we have folate deficiency anemia, we have alcoholism or some liver disease. We get macrocytic anemias, and some normocytic anemia, like in acute blood loss, we get some normocytic anemia. So it's all enough for today, and inshallah see you in the next video. So thank you very much for watching the video. And regarding examination, this is very important, because in exam we can give you some different cases, and you will give it remarks, or along with peripheral smear you will give your comments. So thank you very much for watching.